Good afternoon, everybody. Thank you for joining us for this video update, June 29th, 2021. Everybody here on the panel has a lot of really good information for you. We thank you for attending. Dr. Renteria from our health department, Keith Gregory. I was going to say Keith Graham, my apologies. Keith Gregory from our housing division, director of housing, and Councilwoman Mrs. Frias is going to also give you some information. So I'd like to start off by letting everybody know in the Pascoyaqui Tribal Office of Emergency Management, we have two new additions. Jose Tellez is going to be our training and exercise coordinator, and Mr. Paul Mesa is going to be the deputy director and operations manager. So we welcome them on board. They're going to be working with all the departments on the government side and the gaming side to help us build up this Department of Office of Emergency Management for the Pascoyaqui Tribe. So thank you, gentlemen. Looking forward to working with you all. I will start out with statistics for the Tucson area. As of June 29th, 2021, we had two new cases, two new positive cases reported, and I would like to report that our epidemiologist reported that those two new cases were people who had not been vaccinated. So please think about that when you're being hesitant about your vaccination. Total confirmed cases from all sources in the Tucson area is 1,908. New deaths since last week are 0. We haven't had any. Our confirmed deaths remain at 36. And that was last updated June 26, 2021. For the Pascoyaqui Health Services Division, testing completed between March 23rd, 2020 through June 26, 2021. We have had a total of 12,409 negative cases and 776 positive cases. And total cases recovered is 1,967. As of last week, they are still working 15 active cases. And that's for the Tucson area. For the Guadalupe area, report date of June 23rd, 2021, they had two new positive cases reported. We did not get the details on if those people were vaccinated or not vaccinated. Confirmed positive cases for all sources in the Guadalupe area is 1,753 positive cases. There were no new deaths reported as of last report date. There still is confirmed 30 deaths in the Guadalupe area. Last updated June 23rd, 2021. And Pascoyaqui Tribal Health Services Division for the Guadalupe area between May 11th, 2020 and June 5th, 2021 has a total of 376 positive cases. We don't have the data on negative results, or we don't have the data on recovered cases. And I'd like to remind everybody to please opt into our mass messaging system. It's an Excel system, and you do that by texting PYTRIBE to 888777, and then it will give you the option to opt in. So please opt in, and don't forget our COVID website as well. You can look on there for additional information. Thank you for your time. Dr. Renteria.
Good afternoon, buenas tardes. I wanted to take a moment just to share some information with you regarding the Delta variant of COVID-19. I believe there's been at least a couple of cases now in Pima County, so it is here in Pima County. Basically, it's the latest variant that it's more aggressive in infecting you. The side effects and the chance of you being really, really sick are pretty much the same as the others. It's just that it can get to you quicker, okay? So if you listen to the news or if you're following any type of national media, it appears that this Delta variant is primarily expanding in those that are not vaccinated. And also, as we get more information with those that have been fully vaccinated, it turns out that they actually have now probably less than a 1% chance of being infected by any forms of the variants. So your greatest chance of protection is if you are fully vaccinated. So, sorry, I got a little critter here that likes my cologne or something. But So for those of you that are not vaccinated, I think you really need to be thinking of protecting yourself or consider please getting the vaccine. I believe there probably will be another spike, and that spike in Pima County is going to happen in those that are not vaccinated. What I mean by that is people are going to get sick, they're going to end up in the hospital, some of those people are going to be in the ICU and suffer serious complications. And those will be probably, like I said, most of the cases, 90% or above in those that are not vaccinated. We still have our pod from 2 to 6 p.m. every Thursday at the Albert Garcia Auditorium. It's very easy. Come and get your vaccine. If you have any questions on that, you can get a hold of me to the health department. I'd be happy to provide you more information. Thank you.
Thank you. Go ahead.
Keith Gregory with the Housing Department. Just want to kind of update everybody, not really update, but kind of inform everybody. I know it's summertime, it is really hot. We talked about this last time I was here. It's really hot. I still have on this jacket, so I have not learned that it's still hot. But for everybody out there who is concerned about the condition of their air conditioning unit, the Housing Department is now accepting applications from homeowners who want to have their AC units either upgraded. Oh, it's my turn with the fly now. We want their AC units upgraded or need to have their units replaced or changed over from swamp pools. So just come to the Housing Department. We can take those applications in person. You can call us. We can mail you an application. We're doing a similar thing for our rental tenants as well, but only for those tenants who are in housing-owned rentals, so tribally owned rental units that are run by the Housing Department. For those rentals, you don't have to do anything. We're just going to be coming here. There's a company called PMAX that'll be coming around talking to everybody. We'll be sending out letters to inform you of the dates when we're going to be scheduling your AC upgrade, so that for the rental tenants who are in housing rentals, you don't have to do anything. We'll notify you when that's going to happen, and you'll just wake up one day and have a brand new air conditioner. It'll be nice and cool in your house. But for both groups, if anybody in the community, tribal members have any questions about AC conversions, upgrades, or the status of your system, let us know. Give us a call. We will talk you through the process. We can send somebody out to do an assessment to see what you need to do. For some people, it does mean you'll need a whole new system. For other people, you might only need an upgrade or a conversion. So we'll figure out kind of what needs to be done, but don't hesitate to call us, because while it got a little cool this week, it's not going to stay cool. July and August are coming, so we want to make sure that as many people as can get help do get help. Thank you.
Thank you.
Hello, everyone. Renteria, Frias, and like to extend our continued condolences for everyone who continues to heal from people that they've lost to COVID-19 or for other reasons. We still continue through our healing process. I also just want to give everyone an update on what the Tribal Council has been working on as far as the tribal recognition. I mentioned that the last time that I was here, and and how important it is for everybody to get vaccinated. And we continue to push that because it is very important. And, I was just at the clinic last week and got to see a lot of young people that were out there, a lot of parents that are taking their kids to get vaccinated. And, if you're 12 years old, you can get vaccinated. And we're really hoping that, again, that by that time, maybe if you're 2 years old, that parents can take their kids out there. But right now it's 12. So it's just, I cannot emphasize it enough how important it is to bring your kids now, especially if, they're in summer school and they might have a shorter window. And, if you can work with your supervisors here, if you work with the tribe, or if you work for another employer, how can we work with you to schedule to get your kids out here and get vaccinated? We are doing our best to create any option to get you vaccinated. And if you can't make it here on Thursday, call us. We'll get a nurse to you. There is really no excuse, because we'll make it work. We will make it work because it's that important. And so it's September 18th is the day of our recognition. We want everybody to come out. We want to make it safe. We want to make it fun, and we want to make it a day of honoring each other, the people that we've lost, and to celebrate their lives, and the people that are here to be able to reunite. So it's been a very, very difficult time for us as a nation, It's been a very difficult time for us as tribal people, but you know, we've been together through ceremonies and we need to celebrate, we need to be together. And as we open up some of these other areas, or parks, and you know, with Little League coming up, and we get to see each other at work, we also want to have fun, but we have to be safe. So please do your part and get vaccinated. And please bring your kids out here and your family members and your elders. We still, not all our elders are vaccinated. We're at about 35%. We've got to push it up, people. We've got to push it up. We've got to be safe. And I share this because, you know, it's all about protecting yourself. It's all about protecting our community. It's all about protecting all of us. So please do your part. And I share this on behalf of the Tribal Council. So thank you, and thank you for listening.
Thank you, Mrs. Frias. So, folks, you've all heard a lot of really good information. I'd also like to thank Mr. Lopez and Mrs. Nunez for all their behind-the-scenes work, always providing these video updates. We really appreciate their assistance. And let's remember, just because you're vaccinated doesn't mean that you're bulletproof. Doesn't mean that you still can't get the COVID. You know, you can still be infected by COVID. It may lessen the effect, but so we still urge everybody to still be safe. Wash your hands, social distance when you feel it's necessary, and please wear your mask when you feel it's necessary as well. So please be safe as we all battle this COVID pandemic. And thank you once again for tuning in. We appreciate it.